Good morning. My name is Brian Gifford. I'm the Director of Research and Analytics at the Integrated Benefits Institute. Thank you all for joining us this morning. Today, I'm going to be sharing results from an estimate of the lost work time burden of illness that it imposes on employers. I'm going to discuss some of the numbers that we produced in an infographic just last week. But the real action today is, of course, to describe the model and the tool that we use to produce that estimate, and to demonstrate how IBI members can produce customizable results scaled for their own company or for their clients. As I go through the information today, we do have a Q&A function. If you have any questions that you would like me to address at the end of the session, by all means, use the Q&A, and my colleague Carolyn Ho will keep those moving along to me. Now, I'm going to say a little bit about IBI because, of course, we make this tool, the full cost estimator, and the findings available as part of our nonprofit mission of helping business leaders understand the impact of illness on their ability to run successful, high-performing organizations. So all of IBI's research, all of our analytics, our tools, our educational activities, these are really intended to facilitate conversations in the market that are focused on the business value of healthy employees, rather than solely on the cost of benefits. So if you've been on webinars where I presented before, whether for IBI or somewhere else, you've heard me say this: we all recognize that illness has costs. But what we try to do is emphasize how health creates value, how healthy employees who are able to be on the job consistently, putting in a good performance, are able to make businesses better, to help them do all the things that actually make them a business, to sell the things that they make, to make the things that they sell. So we're always trying to focus business leaders on healthy employees as an investment in business performance. But of course, we do have to address costs. Costs are the starting blocks. So that's where today's discussion is going to begin. So just last week, IBI released some of its estimates of the cost of illness to employers. And so the big number, the one that people or organizations like Forbes, Workers' Compensation.com, what they really focused on was that big scare number, $575 billion a year. For a comparison, that would exceed Walmart's revenues, which were $524 billion in the last fiscal year. That's what put it at the top of the Fortune 500. And so if you look at all the reasons that people are off the job, sick days, short-term disability, long-term disability, FMLA, workers' comp, and this issue of impaired performance, sometimes we'll refer to that as presenteeism. That's like taking away Walmart from the US economy. And if you are among that subset of the health and productivity world who would prefer not to talk about impaired performance and presenteeism, we'd be left with $364 billion. That would still be higher than the number 2 on the Fortune 500, Amazon, and about a third of the number 3, ExxonMobil. So not only are we talking about large numbers in the big aggregate picture, but this is a conservative estimate because, of course, there are many people out there in the workforce who don't have access to short-term disability, long-term disability, and so on. So we're speaking conservatively, and yet we're still talking about $3,900 in health and productivity lost work time per employee per year, and about 1.5 billion days of lost productivity in all employers in the US economy. The report also talked a little bit about the increased costs over time. So IBI has been producing this model we've been using this model with our members since 2016. And again, the infographic showed a cost per employee per year has been going up. It went up by about 8% since our first model was put out 5 years ago. Some of that is due to increased year-over-year compensations. So again, if people are getting paid more, then every absence becomes more costly. But also some of that is due to the increase in different kinds of absence. And again, as you can see here, overall, we're not talking about a really large increase in the aggregate, but this is actually masking some diverging trends that the infographic focused on as well, particularly when we start thinking about the change in workers' comp lost work time per employee per year. And this was one of the most interesting findings for me anyway of this analysis. And so essentially this is still somewhat in formation. We're still doing more analysis on this, but that finding, my analysis is really going to indicate that this is driven by a small but steady decline in new workers' comp cases. I don't think this is going to be new information for anybody. If you follow, for example, the Bureau of Labor Statistics injury and illness and fatality system, you can see that the numbers have been declining little by little over time. But it may also indicate from IBI's benchmarking claims, those may indicate that we're actually seeing some quicker resolution of cases. And so the number of older cases that are carrying over year after year is dropping. What we're left with at the right of this panel is we see more serious cases coming into the workers' comp system, but overall we're seeing a reduction in lost work time per case over time. So that would explain why we would see this workers' comp experience declining over time, somewhat offsetting the increase, steady increase year over year. We might not notice it, but we see a steady increase, for example, in short-term disability days per employee per year, and sick time, recently a little bit more in Family Medical Leave Act leaves as well. Okay. Now, that was really the high-level estimate of the information that we put out last week. But what we really want to do in this session is talk about the full cost estimator, which is how we design it. It's both a tool, an online interactive tool, and a model for estimating the burden of illness on employers. The thing you want to understand about this tool is this is data driven. And so the engine behind this tool is IBI's disability and leave benchmarking data. I know that some people are familiar with this model. Some people are familiar with this reporting system that IBI has. Essentially, this is made up of the nation's largest database of short-term disability, long-term disability, FMLA, and workers' comp claims from employer-sponsored policies. So every year, and we've been doing this since about 2007, we get information, claims level information, from 17 of the major disability insurers and third-party administrators on their books of business. For all of the programs that we cover, we probably have information on about 100,000 employer policies. And we can do report, this results obviously in millions of claims. And we can report out for 2,300 different industry groupings. So at the SIC level, from the highest sector level, let's just say manufacturing, on down to the 4-digit SIC. So lots and lots of detail in this information. These organizations provide it to us so that we can produce these industry reports that can help them benchmark how their clients are doing in terms of their management of their short-term disability compared to the industry trend or the industry average, for example. But of course, these data are so rich that IBI can actually use them for other analytic and research purposes, FCE being probably the most prominent of those. And essentially what we're really doing is showing how much lost time there is by industry for each of these programs. So again, short-term disability, long-term disability, FMLA, and workers' comp. And we're supplementing that information, the actual claim experience and the lost work time experience, with compensation data that we get from the Bureau of Labor Statistics. That's how we understand, for example, for any given industry, what people make, how much they get in terms of all of the employee benefits they have, how many of them are actually eligible for different kinds of benefits, short-term disability, long-term disability. Industry by industry, what do we see in terms of full-time percent, so we understand FTEs and so on. We also, again, because we want, if this is a full cost estimator, we want to add in other ways that illness is going to impact a business and its productivity. So we can also supplement sick day information from the National Health Interview Survey, which we get for the Centers for Disease Control and Prevention. We're able to set different parameters for pay and maximum benefits for workers' comp with information from the National Academy of Social Insurance. And though it's not here, we also estimate presenteeism using the Health and Productivity Questionnaire, which was designed by the Harvard Medical School for the World Health Organization. And IBI was given the data that were used in the validation studies for that. So we're able to supplement that. And this is how we really get this, what we've called the full cost estimator. And we give people the ability to scale it to a given organization size. And what do I mean by that? It means that really somebody who is using the tool, the only thing they really need to provide to get a basic estimate for industry average is select an industry from this large inventory of NAICS industry. If you're not familiar with NAICS, National North American Industry Classification System, excuse me. Select an industry. In the background, the tool is going to generate all of the results. You scale it up to a head count of your choosing. It could be for your organization if you're sitting in the benefits department, or if you're sitting in the HR department, the risk management department, or for your clients. And what this really does is it allows us to, again, model the full business impact of illness. And when we say full business impact, just understand that we're talking about operational outcomes. So we'll model lost work time. It'll produce a model of the total number of lost work days. It can produce, for example, the financial view. So think of that as the wage replacements. I know that there are some organizations out there, if they're going to make some kind of business case to their CFO, to their finance department, we've heard that there are organizations out there that it's been told to people that they should only come with the financial view of it, a very conservative view. How much are we paying when people are not on the job? That gives you that wage replacement view, but also the larger economic view, which we'll call here opportunity costs, which really, and I'll say a little bit more about this during the talk, it captures the additional burden of maintaining a business's output in spite of absences or their lost output otherwise. And we know, I think most people are going to recognize that businesses prepare for absences. They don't just tolerate the losses that would be incurred when somebody has to be off the job. They take steps to ensure that they can still get the work done, or they take steps to ensure that when people come back on the job, they can get the work done. This model has an approach that actually incorporates a lot of that. And again, what do we report? We report outcomes for sick days, short-term disability, workers' comp, FMLA, long-term disability, and presenteeism performance. We give the way you'll see in the report that I'll show you, we try to a form of storytelling here. So the first thing we do is produce the highest, most aggregate results. What are the costs, and how many sick days are driving this? How many presenteeism days are driving this? Then we start to break it down just into which each of these different ways, or each of these different lost work time programs are actually contributing to this top level number. And then we get down into, some would say, excruciating detail into, for example, if we're talking about short-term disability, how many claims are driving this, how many lost work days per claim, how much of those costs are for wage replacements, how much are opportunity costs, and so on. And we want to report these results in ways that are going to resonate with different stakeholders and organizations. So for example, we'll report lost work time in per employee per year. So you get a sense of, for every person that we have, how many days can we expect on average for them to be out for any one of these different ways, sick days, for example, compared to standalone FMLA. We put that in terms of FTE equivalents so that people can get a good sense of how many people are actually, have we in a sense hired who are not working for us. And of course, in terms of your lost input, which to me is one of the most useful, but perhaps underutilized ways of looking at this. It's essentially how much of all of a company's labor inputs are really lost to illness and injury. And finally, at the very top level, we've put this out in dollars that can be compared to people's estimated healthcare spend. And that gives us an opportunity to start engaging people around the way that they're really more used to thinking about illness and injury in their workforce. So just for simplicity's sake, I've run a model using the FCE on a hypothetical 10,000 life hospital, NAICS 622. And I'm going to present what I would call a very basic view of workforce illness and injury. What does it cost us when people are sick, or what does it cost us in terms of our benefits to help people stay healthy? And then what is this additional spend for workers' comp? So in a very basic view, we're looking at about $93 million, about almost $80 million of which are really what people are just going to pay in compensation, but a form of compensation that comes in their healthcare benefit spend. So for typical company, it's about 12 cents on the dollar in terms of their total compensation. And again, all of this comes out of the FCE. This is not pulled from some other report somewhere else. If we want to take an enhanced view of the cost of workforce illness and injury, we might also consider the spend for short-term disability and long-term disability. This is actually the model's reports of the wage replacements, but it could be a good approximation of premium. So again, a 10,000 life hospital, now we're looking at about $100 million in money going out the door, things that would show up on the balance sheet. And I think for most people, the kind of information that they could take to their CFO and say, this is what the costs are that we're aware of for all of the reasons that people are going to be off the job when they have one of these really serious health episodes or injuries. But if we're going to take a full view, we're also going to take into account some of the things that are maybe a little bit harder for companies to pull out of their own systems. I'm always surprised at how many companies cannot get their sick day spend out of their payroll system. I'm sure the companies can get it, but how many benefits people say we don't really have a sick day spend. Sometimes they have PTO banks, and it's hard to figure out how often people are off the job because they're sick. And even more difficult still is to really put into the larger picture the way this matters for the business's ability to operate. And again, we can think of that as the opportunity cost. So we're adding money to, or we're adding value to the cost of a person's absence insofar as you might miss sales, you might have to hire somebody else to replace that absent worker. You might have people who are taking over for the absent worker temporarily, but are not able to do the job as well and do their own job at the same time. So we're modeling all of that. We're also modeling in this issue of presenteeism, which is for people who have chronic health conditions. How does this impact their ability to perform on the job compared to people who don't have chronic health conditions? So this is what we would think of as the full view, $151 million instead of that $93 million that we start with, most of which is healthcare spend and most of which most employers probably know pretty well. And this is where when we start to package this together, when I've broken it out in this respect, just the way I'm presenting it, it's almost as if we're saying that these are completely different things. And I know that a lot of people don't really think of it that way. So the message that IBI has been trying to convey to people all along is, for a company like this, if you're just managing your healthcare benefits, is that where you're putting all of your time? Just understand that you've probably got, when we think about workers' comp, short-term disability, long-term disability, wage replacements, FMLA, I know it's quote unpaid leave, benefits continuation, that's a real spend. If you consider that and the opportunity cost, everything that you're losing or everything extra that you're spending to make sure you don't lose output, it's probably another, in this case, 90 cents on the dollar of what you're managing in healthcare benefits. Think of it another way. Are you putting as much effort into managing health and productivity as you are into managing your healthcare spend? And these things should be working together. So really what we're looking at here is how much is driven by lost work time in a case like this hospital, about 14,000 lost work days. That's going to be about 10 absences per employee per year and about 4 presenteeism days per employee per year. It's the same as having about almost 550 full-time employees that never show up to work or cannot show up to work because of illness and injury. And almost 6% of all the labor inputs that this company is paying for are completely lost. They're not being used to, again, make the things the company buys the things the company makes, or excuse me, sell the things the company makes the things the company sell. I'm forgetting my own catchphrases. Okay. That's the FCE in a nutshell. That's the really high level view. What I want to do now is show you how you can actually generate these kinds of views for, again, your own company or for a client organization. We've tried to make this as simple as possible. It's a really customizable tool, but we really want to be driven by industry averages. And so, for example, I'm going to generate a report for hospitals to just show you how we can reproduce those same findings that I just presented. And so the first thing we're going to want to do is we want an industry that we can index our findings to. And we'll start with the hospital industry. You can look it up either by the, you can search by the name of an industry, or you can search it by the NAICS. We'll just pick hospitals for ease of use. Put in your head count, and that's really all that you need to produce results in any number of ways. One is you can produce in CSV, which is really nice for taking these findings and putting them into reports for clients. You can do HTML if you can't wait for a PDF report to generate and just shows up on the screen, or a PDF report, which I like because it's, in my opinion, it's pretty well organized, pretty easy to read, and it tells a pretty cohesive story. The other thing I want you to keep in mind as you're using the report is it's customizable. And this is a way that our tool actually is going to give you benchmarks within benchmarks. And so the average hospital employer is going to have about 85% full-time employees, 50% short-term are eligible for short-term disability benefits in excruciating detail. Each one of these can be set so that you are actually producing results for a company that is pretty much like your own or pretty much like your clients. Okay, so again, a customizable, scalable tool to produce estimates based on all the different ways that people can actually compensate people when they're on leave. And when we talk about eligibility for leave, to actually model all of the total impact or the total incidence of leave that you're going to have. After that, you don't have to change any of those inputs if you don't want to. If you just want the straight industry comparison, it's calculating the FCE. It's going to generate this depending on the report style that you selected. I'm going to stick with just plain PDF, and that's it. We start off with this really high-level view that I showed you early on. 103 illness-related absences per day, 39,000 days of presenteeism. Total costs, 72.3 million. That estimate of healthcare benefits where I began the presentation, and we're out. This information is going to be available to any IBI member who uses this tool. It seems like it's not a lot, but I think it actually is. So if you're thinking of, if your company is not really far along in terms of its ability to analyze its health and productivity data, at least a tool like this is going to give you the basics between short-term disability, between long-term disability, FMLA, workers' comp, sick days. I'm expecting about 103 illness-related absences per year. You can figure out the per employee per year on your own. It should be enough to start a conversation about how are we going to manage some of this lost work time. Other IBI members are going to be able to go into a little more detail. And so, for example, we're going to break these out by the total estimate of sick days, STD, LTD, all the different programs. And finally, we're going to show you the take in terms of wage replacements and opportunity costs. And so again, we're going to come up with 72.3 million for this organization, all told for everything involved, including all the workers' comp, the legal costs, the medical and pharmacy costs, and so on. And again, finally, there's a last view of the reports where, it gets pretty detailed. So one page for every different kind of leave, going into detail, how many claims we might expect for 10,000 employees in the hospital industry, how many days per claim, what is that going to cost us in terms of wage replacements, what do we base those costs on, and rolling it up to the total. And we'll see the same thing for all the different programs until finally we get to this last view of it. And again, not everybody is going to have this level of detail. It depends on your IBI membership level, but this is the opportunity to start turning it into different kinds of results that are going to resonate with different kinds of people in an organization. So you might want to present days per employee per year as opposed to missing FTEs. If you have that CEO or that kind of organization where you only want to focus on wages and benefits, dollars going out the door without thinking about presenteeism, you're welcome to do so. This report gives you everything you need. It also summarizes all the assumptions that we use in the tool. So some of these I've already showed you, but just to give you a sense of how different kinds of organizations can use this, if you want to go out in front of a client, or if you want to go in front of your CFO, you're going to be best off with a model that reflects your own company's policies. And so, for example, the average hospital or the average health services organization only has about 50% eligible for short-term disability benefits. We can bump that up to 100%. This is a great place to work. Everybody is eligible for short-term disability. Everybody's eligible for paid sick days. Even though this model includes the people who are not eligible, it still includes how many sick days they're going to have. It just changes the way that they're paid. We can change salary, we can change any of these benefit levels and run an alternate model. And this is a really good way to start comparing different scenarios. So what would our take be if we were, or what would our total cost or our total impact be if, for example, we had everybody covered for sick days or for short-term disability? Now you have the ability to conduct a side-by-side view of what the real outcomes are going to be, or what the real differences are going to be. And so again, we started off with a view. I'm going to go straight to the detail if you don't mind. We started off with a view, that had $27.5 million in wages and benefits for an example. We've bumped that up because now everybody is eligible to be paid for sick days and everybody is eligible for short-term disabilities. We've bumped that up to about $34 million. Okay, and we can do that for all of the different inputs that I showed you until you're really getting pretty close to a company's benefit policies that you're trying to create the model for without ever changing the underlying information that feeds into what is the incidence for long-term disability or FMLA or any of that. Okay. Somebody has also asked if we have the opportunity to show the benchmarks regionally. Great question. The only thing we can do to make regional adjustments is going to be in workers' comp, because we don't have a model that basically says short-term disability for New York versus California. What we can do, however, is, again, for workers' comp, give people the opportunity to change at least the wage replacement rate, which is going to vary from state to state, and the maximum weekly benefit rate. So a lot of the regional variation, some of that is going to be actually taken up by the industry. The same thing with regional variation in compensation. So again, if you've seen the models that we put out on coronavirus cases, where we have adjusted this for the number of cases showing from place to place, we know that different people in different parts of the country get paid different amounts. We can always change the wage and salary benefits. And that's going to change, by the way, based on the industry you select. So again, showing some of these industry level benefits eligibility. If you just want a comparison, if we want to look at just retail trade and we go to the customize, we went from 50% eligible for short-term disability for the hospital industry to 33% eligibility for retail trade. So not specific to regional outcomes, but if you can think about all the different ways that companies might, that outcomes might change region by region, you might want to start setting different kinds of defaults for your model. So again, thinking about the industry itself is going to take away a lot of the benefits differences, the wages, the workers' comp policies, that might get you there. But again, let me go back to the very beginning of this conversation. All of these tools, IBI does not create tools so that we can say to an employer, this is exactly how it is for your company or for your industry. We really create these tools to facilitate conversations, and those conversations should always be centered on how does this work in your company or your industry? Do you even know how it works? Do you have the ability to take a look at a model like IBI's FCE and actually go back and look at your own experience? So do you have a way of conducting surveillance on how many sick days you have if you have a PTO bank? Do you have the opportunity to look at what your actual claims rate is for short-term disability or long-term disability and so on? And this is the opportunity for people to either start working within their own organization to find these kinds of answers, or if you're a partner organization who is helping out clients, to actually facilitate with them to get some of these answers, whether you have to go to another source, one of their other partner organizations, to pull the information together, or whether you're trying to look inside of your own book of business so that you can at least give them a credible estimate. Finally, one last question: are healthcare costs total or just the employer share? The healthcare costs that we estimate are actually based on payroll. So companies that are paying out 12% of their wages and benefits, 12 cents on the dollar of their payroll expense is going to be for payroll, that would just be the employer share. And again, we have not built into the model a way of allowing people to adjust the healthcare spend because, well, for two reasons. One is it's a number that most people know pretty well, but also it's an opportunity for them to go back and really start thinking about how much of that healthcare spend is driving some of their outcomes in terms of short-term disability, long-term disability, and so on, right? We're the Integrated Benefits Institute. We really want companies to take a look at their entire benefit strategy rather than siloed by siloed. We recognize the irony of producing results where we have siloed the outcomes. But again, these are conversation starters. These are not conversation enders. We would never want to say to a company, this is how it is, and if you are different from this model, you're wrong. More likely we're wrong. But at any rate, this tool is available for all IBI members. All you have to do is log into IBI. If you don't have a login yet and your organization is a member of IBI, make sure you get yourself registered. No matter what member level you are, you'll be able to produce some kinds of results. Again, it might be just the top level results, but what we found is these can be really powerful openers for conversations about how to start better managing the health and productivity of your workforce, not necessarily just to cut down costs, but to actually improve the performance of the business as a business. And with that, thank you very much for joining us. If you have any questions, we'll be distributing the slide deck later this afternoon. But if you have any questions, Brian Gifford, bgifford@ibiweb.org. Do not hesitate to reach out to me. I'm always happy to talk about IBI, the FCE, health and productivity, and any other thing that our members are interested in. So thank you very much.